and that can lead to obviously more pressure being put on the heart, and then that could lead to like a heart attack or something like that. Tar is a well-known carcinogen that is deposited along the respiratory tract, and that's gradually absorbed, so it just sits along the neck and the cilia, or within the bronchioles and the bronchus of the lungs, and it's just gradually absorbed within the body, and yeah. So smoking can increase the risk of coronary heart disease, cancer and lung infections. So smokers are more prone to diseases like these and colds, as the smoke damages the cilia and the lining of the airways. So the mucus can be infested with pathogens, and that can't be removed from the body as easily, because what the cilia do is they waft the mucus up, and that's why you get like phlegm in your throat and stuff. And obviously if they didn't work as well as they do, they won't be able to waft away the pathogens that are trying to get into the body, which cause infections, and so you'd be more prone to infections. Passive smoking can also be just as dangerous as active smoking, and is a growing health concern among some professionals, because obviously you're still breathing in the smoke from the cigarette, so you're still kind of taking in those pathogens. Smokers are at a higher risk of developing fatty deposits within the arteries that can block those arteries in and around the heart. These deposits can block the blood flow and obviously starve the heart of the oxygen from the lungs. They're a main factor related to coronary heart disease, and they can result even more so in a heart attack. Smoking increases the risk of coronary heart disease because it increases blood pressure and the levels of bad cholesterol that go on to form the fatty deposits. Lung cancer is commonly linked to smoking, but other types of cancer can also be caused, such as mouth cancer. That's for one. It's thought that these cell mutations that lead to cancer arise from the tar in cigarette smokes, so that smokers are more likely to suffer from chest infections and colds and flu than non-smokers, and pneumonia and chronic bronchitis are all other diseases most commonly associated with the smoking population. Obviously there's no recommended guidelines for smoking, because it's something that damages you, so you can't really put a guideline on something that damages you. So stress. Stress can consist of physiological and psychological responses to your environment, and stresses are factors that induce stress responses. So these are things such as major life events like marriage and divorce, injury or trauma, like a car crash or something like that. And it can literally be just about anything. It can be stresses, as well as the accumulation of daily hassles, such as just your car won't start, you're on your way to work in traffic, stuff like that. Something that can happen on a daily basis. Chronic stress raises cortisol levels in the body and can lead to lower disease resistance, hormone imbalances, or increased risk of coronary heart disease. And you can also be feeling more muscular pain or tension and emotional tension, as well as experiencing some sort of eating disorder. Stress can do a lot of things like that, because being more stressed, you're worrying about other things, so you don't take as many precautions in other areas, and because you're focusing on that, you don't focus on other things. Other health risks that are associated with stress include hypertension, angina, strokes, heart attacks and ulcers. Angina is the sensation of pain experienced in the arms and the chest, and that's when blood flow and oxygen supply to the heart is limited. That's linked with coronary heart disease, and coronary heart disease is more likely to occur with chronic stress, so like really bad stress. And stress can also lead to increased gastric acid levels, which is what causes the ulcers. And long-term stress can can cause constantly raised blood pressure, and this can also increase the risk of heart attacks and strokes. And lastly is diet. So diet refers to what we typically eat, and a balanced diet refers to a diet that will enable us to obtain the correct amounts of each nutrient we require. And you see that on something called an eat well plate, which I can go on to in a second. Deficiencies, excesses and imbalances in dietary intakes can have negative consequences for our health. So any imbalances of diet, so eating more fat or eating less fat, they can have negative consequences to health. A lack of vitamins and minerals can lead to health problems such as scurvy, which is a lack of vitamin C, osteoporosis, which is a lack of calcium, and anemia, which is a lack of iron. Excess calories can lead to obesity, while excess fat can lead to coronary heart disease. Physiological demands from our diet vary throughout our lives. So, for example, during growth or pregnancy, so obviously pregnancy, women crave more foods than others, so they'll eat those foods, and that will change their diet because of that. And obviously during growth, for a child, they should get more calcium in their body rather than someone who's already, like, the bones have already grown, let's say, for like an adult. A healthy diet will provide adequate energy for body functioning and offer protection about disease. So there's different recommendations for the different things that you can have in your body. So for fat, the recommendation is that you take in less than 35% of the total energy is taken in by fat. So this is the energy recommendations for each one. Saturated fat is no more than 11% of that 35. Protein is to be no less than 15% of your total energy, and carbohydrate is a total of 50% of your total energy. So half of your energy is coming from your carbohydrates, and the other half is coming from fat and protein. Fibre, the recommendation for fibre is no more than 18 grams a day, as well as salt is no more than 6 grams a day. And the different calorie intakes are different from age and job description and job type. But the average male should eat around 2,000, and the average male around 2,500, and the average female around 1,500 to 2,000. And then the eat well plate. So the eat well plate is a good way of monitoring your dietary intake, and it identifies which dietary components should be eaten and in what proportions. And a general guide to eating healthily would be to limit alcohol consumption, so don't take in as much alcohol, reduce the fat intake, so not eating as much fats, avoid positive or negative energy imbalances, so and then eat plenty of starch and fibre, reduce the amount of sugary foods consumed, enjoy food and don't become obsessed with dieting, and use salt sparingly, so don't use as much salt. So the eat well plate by itself is this here, and it includes at least 5 servings of fruit and vegetables each day. It includes milk and dairy foods, which are about 3 servings per day. It limits your intake foods with a high fat and or sugar content. You eat smaller portions of meat and fish, so try alternatives, and then it bases all your meals around starchy foods.
Thank you.